Good afternoon, everybody.
Good afternoon.
There you go. Well, as the Mayor said, my name is Segun Idowu. I am proud to be the incoming Chief of Economic Opportunity and Inclusion. And the reason I'm here, even though the beginning of that was incoming, is because there is no start date or end date to public service. And so the job of this cabinet is too important to wait to come in on January 3rd, but rather ensure that our cabinet is working very hard to protect our small businesses and our workforce. So I just want to say a couple of things. I'm the grandson of a preacher, so normally we talk for about 30 minutes, an hour, but I know that we don't have that kind of time this afternoon. But I just want to highlight two things that were brought up by Mayor Wu and Dr. Ojikutu, ways that we are supporting our small businesses, which is vitally important, particularly in Black and brown communities, because they are the lifeblood of our economy. The first is the pilot sheltered market program, which is going to allow the city to identify up to 6 contracts between now and June of 2022 and prioritize women and minority businesses for those contracts. This is a major step forward in the life of this supplier diversity issue here in the city. This is something that Mayor Wu championed during her days in the council and which she prioritized in the campaign. And the minute she came into office, ensured that we were immediately acting on this, because as we know, in previous times, the city has not done enough to do business with our businesses. And so we're really excited, the members of our cabinet, to work on identifying these contracts, promoting it to women and minority businesses, and making sure that this city is investing in our small businesses. The second way that we're supporting our small businesses is what Dr. Ojikutu just shared with you, which is the vaccine mandate. The best way that we can protect our small businesses is by ensuring that the people who are working there and who are entering there are healthy. And so this vaccine mandate is something that small business owners, with my role previously at the Black Economic Council of Massachusetts, have been calling for. They wanted to ensure that the city was putting this mandate on businesses rather than a hodgepodge of businesses making the decision for themselves. This ensures that the city is going to be providing resources, that we're going to be providing necessary information to small businesses and entrepreneurs, and ensuring that we are protecting, again, our workforce and our businesses. The way that it's important, the mayor has been prioritizing equities from the moment that she came into office, and so for the vaccine mandate, equity is laced throughout this process, ensuring that the information is easy to understand, easily accessible. And beginning in January, because the mayor prioritizes collaboration, the Economic Opportunity and Inclusion Cabinet will be collaborating with Brianna Miller, Chief of Community Engagement, and many other city departments to begin walkthroughs through our Main Street districts to share this information, because we know that when it comes to equity, there's a huge digital divide, particularly in communities of color. And so we know that not every business owner is going to be able to access that information online, to be able to print out the sign and put it in their window. So we're going to go to the business owners and provide that information, provide those signs to make sure that they can fully comply with this mandate. So like I said, I'm the grandson of a preacher and the son of a preacher, and so everyone who knows me knows I like to walk around with a bunch of proverbs and sayings. And so as I think of what this cabinet is going to focus on and how we're going to carry forward the agenda and the vision of Mayor Wu, I think of one proverb that says that if you want 1 year of prosperity, grow grain. If you want 10 years of prosperity, grow trees. But if you want 100 years of prosperity, grow people. And the priority of this cabinet, of this administration, is going to be to grow people, to ensure the future prosperity of our great city for many generations to come. So thank you all very much, and looking forward to this conversation.
Thank you, Chief. Now I'll give it over to Maria.
Buenas tardes, everybody. Good afternoon. My name is Maria and I have the honor of seeing some of you for the first time after a long time. Now seeing some of you and serving as the mayor's senior advisor at the moment. Pleasure being I'll be here taking questions after supporting anything that I can. Gracias.
So we're opening it for questions.
Yeah, Eve Kajik from MCTV Boston Airport. My question is not the journalists, it's the small business owner. During the past 18 months, before this administration and your administration, in terms of communication, you did a great job. communicating with personally myself every day, 5, 7 press releases. That's good. Boston Media Commission, I receive everything for the community. That's good. On the communication side, perfect. But sometimes the previous administration, and I cannot, say about your administration on the 30 to 34 days, they forget, we are also the ethnic media, small business. A lot of money has been spent, for communication, around COVID. Go to churches, that's good, because that's where people go. To CDOs, that's great. But guess what? They have to go through us to communicate your messages. But no matter what, for 18 months, we have to provide information to the community. Money or not, we have to do it. But in your plan, what are you going to do in terms of, to help small business get access to the I don't remember the exact number, 4.2 billion you spend every year, and only maybe a tiny piece goes to small business. What are you going to do dealing with the small business, like the media, maybe?
And I know Chief is going to weigh in on this too. I think we've seen over the last year how much we would, if doing things how we had always done them, resulted in the same gaps, the same holes, and the same disparities. And whether it was the initial way that vaccines were rolled out, a year ago, or some of the early lessons from the pandemic, it was when community members stepped in and when we partnered with community. And I'm so grateful that Dr. Ojikutu stepped into this role and now has fully stepped into ensuring that our cabinet has a direct public health voice. We know that we have to follow the lead of communities to meet people where they are, and that you all, as multilingual media, are the front lines of that. So we'll have a more specific plan in terms of how we continuously build into our communications cabinet. Today we just announced our new communications chief, Jessica Pierre, who will ensure that the way that we are even structuring our communications cabinet is different and is focused on prioritizing neighborhood media, grassroots media, multilingual media as well, not just public budget, absolutely.
Sure, yeah, so, and you're absolutely right. I mean, when I grew up, I still remember the smell of, and the ink, I wash my hands, so it's not my hands anymore, but the ink of the Bay State Manor, because that's how I got my information. So you're absolutely right that our communication channels need to be prioritized in how we get this information out. I know it's a priority for us. And then in particular, in terms of making sure small businesses get a piece of the pie, I think is what you said, right? This is going to come through the partnerships that we have as well, not just the programming that we put in place in the initiatives, but who we have these strategic partnerships with. Again, coming from an advocacy organization that pushed to make sure that our businesses were getting contracts, I know that the way to get that is to partner with organizations like yours, or Backmind, Amplify Latinx, others, because they know who those businesses are. And so when these opportunities are available, it's working with those organizations to say, here are the opportunities, let's make sure your members get access to them, let's support them as they bid on these contracts and ensure that we're hitting our goals.
But I have to be precise. With money or without money, we have to do what we have to do. In terms of communicating information about the people.
That's right.
And so I would welcome, I know our whole team would love to keep getting your feedback too. We want to make sure that this kind of meeting, maybe City Hall's not the most convenient, maybe Zoom is more convenient, maybe we rotate around the neighborhoods, but to have a regular scheduled community media roundtable, I think is going to be really important to us. Thanks, Taylor.
All right, series of questions. Why not a negative test option? Dr. Ojikutu said that this is not for the people who have already been vaccinated, but the other 30% that made a choice not to do so. My son is 18 years old. He has not been vaccinated since he was 2 years old. He recently got a job at a venue in Fenway. He can no longer move forward with onboarding because from 2 until 18, I made the choice not to vaccinate him, and now at 18, he don't want to be vaccinated. So it's either money or a choice that he does not want to make. What about the people who currently work at these venues? Are they now unemployed? And how will they be compensated? What about the people who, for instance, my sister has a health condition. If she gets vaccinated, she will die. It's in her health records. Don't even ask her if she wants it. She can no longer come to my father's birthday party because it's after the she won't be allowed in the venue. If they have an outdoor space, can I still go inside in order to go to the outdoor, or is it going to be no? It's a slippery slope. We're talking about May here. We're talking about May of next year, of making 5-year-olds get a vaccine when parents are making the choice not to. So this is a slippery slope to now daycares are like, I'm not receiving a child that's not vaccinated. So either my child doesn't go to daycare or I have to go find somebody that will take him. And that's slippery slope, that's future. It may not be right now. Another question. This is stupid, but at the same time, for someone who paid for a yearly gym membership, are they gonna get reimbursed from the city? Dumb question, but serious. Companies that say, this is fascist, I have a choice. As a business, I do not want to mandate people to come in here to be vaccinated. What are they gonna be fined? Because I sat here for the last 10 years and talked to City Hall. We can't make businesses hire and sustain black people working for them. I can't force public housing to do the X, Y, Z, but you can force me to make a health decision? I'm confused and I'm angry and I'm upset that you're taking away my options. Dr. Ojikutu, as far as these numbers are concerned, people are dying. My friend just died of COVID. He was vaccinated, boosted up, masked up. People are still dying, yes or no, after being vaccinated. The vaccine is not the end-all, be-all, cure-all. Does it help? Yes. But if you're vaccinated and it's supposed to protect you from me, the unvaccinated, how are you going to force me to get vaccinated? I'm not understanding how, it doesn't add up for me. Last question is I would like the numbers. Dr. Ojikutu, you said if. There was like 3 different ifs in there, so it's like possibility. So I would like the numbers of who in the last umpteen have died of COVID that were vaccinated and that died unvaccinated.
So I'm going to defer to Dr. Ojikutu on some of the more specific health information and expertise. I'll just say this is a moment that we, as a society, haven't seen in like 100 years. The last time we had a pandemic and millions of people died around the world, we have lessons that we have learned from then, and we have the ability to affect those numbers even day by day right now. And so I know it's really hard, right? I have 2 boys. I have to think about what it means when I'm putting them in situations where they don't have full control and it might have an impact on the rest of their lives as well. We have to make sure first and foremost that they have a chance to be part of the world in the future as well, that they can be safe and healthy and alive and part of this community. We're not trying to force anyone to make a decision that they, for their own personal reasons, can't make or don't want to make. And there are medical and religious exemptions still built into the policy. So for your sister, I believe, or your relative, for example. There are also many ways in which this policy is designed so that people can still and have to still be able to access the daily necessities of their life, right? As Dr. Ojikutu was saying, nobody is barred from going grocery shopping, from doing things that are not as high risk indoors. But for eating inside, for going to a show, for going to the gym, in this moment, this is still a public health emergency, and so we have to take those actions. We're doing everything we can on the other side as well, right, to set up outdoor dining so that, and nobody would be asked for proof of vaccination to eat on a patio outside. So we're working quickly to make sure that that's all ready to go, and there's jobs available for that, and that we can provide every angle of trying to keep things going. But the reality is that if we do nothing, we will have to shut down our businesses, and many of these jobs will go away once again. It'll be like a year ago. So we have to act differently now that we have the vaccine, and this is the best way to make sure that we can still keep living with COVID as a society and as an economy.
So first, I want to say that I understand where you're coming from. I have friends who have not been vaccinated. I listen to them. I spent most of my time before becoming the executive director talking to people, trying to encourage them, but also meeting them where they're at. Understanding that mistrust is normal and rational in the world we live in. You know, given all the what's happened to people in terms of structural racism, the ways that institutions have treated people, that's rational. I do understand that. But what I would say is that we're truly in a state of emergency. And I've asked that friends, family members, anyone who was hesitant, just wait, see, but eventually you gotta get vaccinated. At this point, nationally, in terms of safety, more than 500 million doses of the COVID-19 vaccine have been given out, with very rare side effects and mild sort of after effects, as you know, probably read, pain in the arms, some muscle aches, slight fatigue, those sorts of side effects. So at this point, we feel that these vaccines are safe, and we also know that they're effective from very large clinical trials and from data that's been collected over the time since these vaccines have been under emergency use authorization. So in terms of the actual numbers, if you look at the cases here in Boston, probably 2/3 are amongst people who are unvaccinated. If you look at hospitalizations statewide, more than 2/3 amongst people who are unvaccinated. And these are the people who end up dying. In a large study done by the CDC, they looked across numerous states. Essentially what they found is that if you are unvaccinated, you are around 10 times more likely to be hospitalized and around 10 times more likely to die. Those data have been published widely, and it's true. I mean, it's what we're seeing in our hospitals. So what I would say is that we have to follow the data, and we have to realize that we're truly at the point where we need to encourage people to get vaccinated, to not only protect themselves, but to also protect our infrastructure, our communities, and to protect our ability to stay open as a city. The reality is that I don't see COVID going anywhere soon, right? You're nodding your head, so I don't see it going anywhere. We're gonna have new variants. There's gonna be Pi, Sigma, Rho, we're gonna have new variants, particularly if people are unvaccinated. We have to learn how to live with COVID. Our hospitals have to stay open. We have to be able to go to school. The way to do that is to get people vaccinated. And that's
And
honestly,
what about choice? I haven't heard either one of you speak about choice. It's my choice. I'm not getting vaccinated. It's not going anywhere. I am going to get it. I already got it. I'm going to get it again. Just like you get the common cold, just like you get the flu. I don't get the flu shot either. I've never had the flu, ever, but I've never had a flu shot. I want to hear about choice and the ability to have a choice while being a Boston resident.
well, I can say that the way that this policy was written, it doesn't exclude people from activities of daily living. It really doesn't. We're talking about places where we know people will unmask.
Nas comes to Boston, I can't see Nas. I want to go to dinner, I can't go to dinner. That does prevent me.
Right,
So,
right.
one example. So, I think there are lots of ways in which we have put other protections in place that do restrict people's choice at the moment that they, like, if you're in your home, I'm not talking about you, but just in general, we're in our home, we're not in because that is going to keep you and the rest of your passengers safe. The moment that you set foot into a restaurant, you're supposed to have shoes on and clothes on so that you're not, causing unsanitary conditions in the restaurant. Or in a lot of places, we're not supposed to bring pets inside except for limited exceptions because it can cause other illnesses that will then affect other people. So this is really about the ways in which we are interacting with each other. It's not about limiting anyone's individual choice, but the moment that anyone's choices in any way, any of the seconds that make up your day start to touch other people, that in an emergency, that's where we have to start putting some parameters in place.
I think that we need to move on.
John Paul had a
Oh,
comment.
sorry.
Oh, you were supposed to listen for.
She had risen first.
Okay.
Yes, thank you. Together with the Boston Asian Radio and TV station, and together with Sportsman as a Chinese platform, and we want to stand on the perspective for the students in Boston. And first, we want to clarify that we support the new policy because of we think vaccination is definitely a great choice for all the citizens in Boston. But standing on the perspective of foreign students, maybe they took the fully completed the vaccine, local vaccines overseas, Sinovac in China or Sputnik in Russia. So for these foreign students, do they need to 2 doses in Boston, or they need just 1 booster, or they have any other rules for them to define them as fully vaccinated in Boston? Just curious of this specific detail. Thank you.
So that's a great question, given the diversity of our population here in Boston. So the CDC has made recommendations in regards to Sinovac or AstraZeneca, which are vaccines that are not available here, but that other people have gotten and finished and completed their series elsewhere. If these vaccines are approved by the WHO, the World Health Organization, then they are acceptable here. People should be boosted, and the CDC has recommended that they receive their booster dose 6 months after their last dose, similar to what we do here, what we would recommend.
So if they want to take the booster, just not to 6 months, if they come to here for school, right? But maybe the month is not long enough for the 2 doses. Can they take booster? Because I come from Boston University, and the CBS near my school just defined the students in Boston University cannot take a booster because we have fully vaccinated in China now. So we cannot take 2 doses in the United States. They have the rules for that. So I'm not sure after the new policy, can we allow to take 2 doses in Boston, or just we are banned from the.
If you're defined as fully vaccinated, and those rules are defined by the CDC, that's 2 doses, and as I mentioned, it includes the doses that are related to the vaccines that have been approved by the World Health Organization, then that fits within our policy. That doesn't, as long as you're meeting the requirement of that fully vaccinated definition. I would add, because I think it's very important, that boosting is incredibly important, specifically if we're, in the setting of the Omicron variant. We have not adjusted our policy to include that booster dose yet. Once we get the guidance from the CDC regarding that, we will add that to our policy. Hopefully that helps.
It wasn't long ago that Russell Holmes Pen was among the lowest vaccinated area in Boston. Among the ethnic groups, I know messaging is very, very important, but who are the messengers is also very, very important. Now, will you be sitting upon delivering these messages via the right channels? Or are you maintaining the same old mainstream of systematic that has been there forever and that hasn't really gotten into us? That's one. I got a phone call this morning. Your free testing areas, people are just lining up and tired of 1 hour, 2 hours, or 3 hours waiting time. I had a friend of mine who had traveled just throughout all over Mass to see whether he could get a test done. And the time was just outrageous. So he called me up thinking that I might have some connections to get him through. But
our overall work. So definitely people are at the table, but I would love to hear if there are people who are missing from that table, and please just let us know. So in terms of testing across the city, I have to, just be very clear that, and I would say not just across the city, but across the state, there's a lack of the PCR testing, right? So there's the PCR testing, and there's the rapid antigen testing. I told you about the rapid antigen testing kits. So the standing testing, the PCR testing, it's in limited supply right now. We are talking to the state to try to get more sites open, and as soon as I know more, I will let everybody know. I mean, this is something we're definitely advocating for. In the meantime, we want people to have access to these rapid antigen testing kits, and like I said, we're putting more out there for people to access, particularly in neighborhoods where there's lower vaccination rates or higher positivity rates. So that's one of the things that we prioritize in terms of access.
A word of advice, Mayor Wu. Often your staff will say, well, why don't you consult the website? And you talking not to a full world that understands the meaning of it. So please, the assets of the ethnic mediums, if there's a connection that can be made through them to channel this information out there, I think it will do much better.
I'm sorry, you and then you.
Hi, I am Andrew Shaw from Caribbean Diaspora Connect. I endorse the mandate because in the Caribbean we are used to vaccine mandate. I had the privilege of traveling in other states, and I just, about 3 months ago, I just came back from Washington, D.C. Seattle, not Washington, D.C., Seattle, Washington. When I landed in Seattle, the first thing that appeared on my phone was an app to download to notify me. It's the Washington Notify app. Is the city looking at developing that similar app for the city itself in terms of notifying you where hotspots are, being able to provide information on where clinics are located, where testing points are located? Since whether we like it or not, we are transitioning into a technology world. Things are advancing, so will we be looking at having that streamline of information on an app so that persons who are technology driven, which is about 60% of the population, will be able to look at it just like what Washington has done, Seattle, when I went to Seattle. So I could have seen, if I'm in a room, we know that, we can identify persons who are not. Information is provided on that. I would like to.
Absolutely, and we always need to continue closing the digital divide in Boston and making sure we're meeting everyone where they're at. But I think a lot of the anxiety that's out in the community about the pandemic has been related to feeling uncertain about what the information actually is and wanting to follow along and know how to get where the resources are. So I haven't said this to anyone yet, but I have been thinking in my head about how do we, once we have our permanent chief information officer identified, really think about an app that could have a lot more resources than just a vaccine proof, because we are going to need it, unfortunately, as Dr. Ojikutu says, whether this virus or another virus, we need to be investing in our public health infrastructure, and that technology is going to be a key piece of it.
Have you guys thought about turning it around from a positive point of view, meaning that if you go to a restaurant now or after January 15th, you will be assured that you are surrounded by vaccinated people. So rather than kind of messaging being, like it's a positive for restaurant owners, for small business owners to kind of use that as a pro-marketing tool, saying you are safe in our restaurant now because we have no choice, but everybody here is vaccinated. I was just in New York and that was the feeling like that. Everyone was there vaccinated, so I didn't let my guard down, I still put my mask on everything, but there was this higher sense of security. I think it's a good marketing tool.
No, you're absolutely right. I didn't like that question, by the way. But the point that I was making on Monday, but also what I've been hearing from small business owners in previous role is that this helps boost consumer confidence. The best way to support our small businesses is by making it safe enough that people want to go out and support them, whether it be eating, entertainment, or fitness. And so, you're absolutely right. I mean, again, when I was talking to business owners, on something like this to ensure that when people are taking off their masks, they know that it's another vaccinated person. Patrons want to know that all the employees that are working there are vaccinated. And so, absolutely, this is a boost to consumer confidence that will allow folks to be mindful and feel like they're safe when they're in these spaces. So you're absolutely right.
Okay, Marv Neal, Urban Need. Couple of things. First, I say on behalf of myself, I'm not sure about everyone else here, I'm more than happy to accept the testing kits as well as masks to distribute to the listeners in my community. I'm happy to do that. The second thing is, as the gentleman spoke in regards to media buys, I just want to impress upon what he said, stress that it's important that us as the on-the-ground media outlets be included in the media buys. When you turn on the TV, you're seeing things that's happening in the city of Boston, and for the most part, we're not included in pushing that message out to our people. So, just keep us in mind, as you all move forward when you're making your media buys, instead of, dumping millions of dollars into Channel 5 and 4 and 7, send some of that to us so that we can survive and get the message out to our people as well.
Because we have time for maybe one more, sorry.
Thank you. My name is Oswald Lepton from Radio Concord, and I am also an ambassador. We have a group of people knocking doors, encouraging people to get vaccinated. And what we found out is most of the resistance come from the people, from the church people. I didn't hear you talk too much about the churches. Okay, with this vaccine mandate, is it going to be applied to the church? Are you going to find a way to work with the church so more people from the church can get vaccinated?
Oh, sure. So we partnered with a number of churches throughout the Boston